Important message. Chronic kidney disease is silently affecting millions across the United States, and diet plays a major role in either helping or harming your kidneys. If you have CKD, choosing the right fruits can support kidney function, reduce inflammation, and protect against further damage. When it comes to kidney health, most people in the United States don't realize how dangerous certain fruits can be, especially if they are high in potassium or phosphorus. At the same time, they also ignore some of the best options that can help lower oxidative stress, control blood pressure, and support filtration. If you've been diagnosed with chronic kidney disease or are at risk, understanding exactly which fruits support kidney health is not optional. It's absolutely critical. And the problem is that many people in the United States, United Kingdom, Canada, and Australia assume that just because something is natural, it's automatically safe. That's false. CKD patients can't afford to make vague assumptions. A single wrong fruit can elevate potassium levels too high and cause serious cardiac issues, while the right fruit can reduce blood pressure, regulate blood sugar, and even slow the progression of kidney decline. The first fruit on this list is blueberries, and this isn't just a trend. In the United States, they're often called a superfood for a reason. Blueberries contain powerful antioxidants called anthocyanins. These compounds actively reduce inflammation and protect the nephrons in the kidneys. Clinical trials have shown that anthocyanins may help reduce oxidative stress markers that are elevated in CKD patients. And unlike bananas or oranges, blueberries are low in potassium, only around 114 mg per half cup, which makes them a much safer option for people with reduced kidney function. Blueberries can also improve insulin sensitivity, which is extremely important since diabetes is the leading cause of kidney failure in the United States. When blood sugar levels spike too often, the filtration units in the kidneys get damaged. Blueberries help blunt that damage. And because they're low in phosphorus and sodium, they're not placing extra burden on already struggling kidneys. Another kidney-safe fruit is red grapes, and they're vastly underappreciated in the average American diet. Red grapes are rich in resveratrol, a polyphenol that has demonstrated renal protective effects in multiple studies. Resveratrol is known to help reduce proteinuria, the leakage of protein through urine, which is a major sign of kidney damage. In fact, some nephrologists in the United Kingdom recommend red grapes in moderation as part of a controlled renal diet for stage 2 and stage 3 CKD patients. What's even more critical is that red grapes support cardiovascular health. CKD and heart disease are intimately connected. Most CKD patients in the United States will die of heart disease before ever needing dialysis. The vascular support from red grapes helps reduce LDL oxidation, supports healthy arteries, and lowers blood pressure, all of which reduce strain on the kidneys. Plus, their potassium content is moderate, about 288 mg per cup, so as long as portions are controlled, they're safe. You just can't overdo them. Apples deserve their place high on this list because of how kidney-friendly they are, especially in early-stage chronic kidney disease. Apples are low in potassium and phosphorus, and they're high in soluble fiber, like pectin. That fiber helps regulate blood sugar and lower cholesterol, both of which can directly impact kidney function. Many dietitians in Canada include apples as part of renal nutrition plans because they help reduce systemic inflammation, and inflammation is a core driver in kidney scarring and nephron loss. Even in dialysis patients, apples are often considered one of the safest fruits to consume because they don't significantly impact potassium or phosphorus levels. And apple skin contains phytochemicals that have antioxidant and anti-inflammatory effects. Eating apples raw rather than in juice form is essential because juice eliminates fiber and spikes blood glucose levels much faster, which can worsen diabetic kidney complications. Next on this list is cranberries, and not just the juice, real, whole cranberries. Especially in the United States and Canada, cranberry juice is often promoted for urinary tract health. But whole cranberries go beyond that. They are extremely valuable for kidney health because they help prevent bacterial adhesion in the urinary tract, reducing the risk of infections that can spread to the kidneys. Chronic UTIs can silently destroy kidney function if left unmanaged. The proanthocyanidins in cranberries are responsible for this benefit. And more importantly, cranberries are extremely low in potassium, sodium, and phosphorus, making them one of the safest fruits for even stage 4 CKD patients. Just avoid sweetened cranberry products. Many processed cranberry snacks and juices in the United States are loaded with sugar and high fructose corn syrup, both of which elevate blood sugar and increase inflammation. Strawberries are another fruit that combines powerful antioxidants with kidney safety. They're rich in vitamin C, manganese, and plant polyphenols like ellagic acid, which help reduce oxidative stress and prevent damage to the kidney's delicate filtering structures. In people with CKD, the risk of inflammation-induced fibrosis in the kidneys is extremely high. Strawberries help buffer this by reducing pro-inflammatory cytokines in the blood. And they have a potassium level of about 120 mg per half cup, which is considered low enough to be safe for stage 3 CKD patients, according to guidelines followed in both the United Kingdom and Australia. Another benefit is their high water content. Many kidney patients struggle with dehydration or fluctuating fluid balances. Strawberries help contribute to hydration without overloading the system with electrolytes. However, portion control remains essential. Too much can lead to elevated oxalate intake, which isn't ideal in patients with a history of kidney stones. If you've never considered pineapple a kidney-friendly fruit, you're not alone. Many CKD patients in the United States are confused because they hear conflicting messages about tropical fruits. But pineapple is actually one of the best low-potassium options out there. Unlike oranges, kiwis, or bananas, pineapple contains only about 180 milligallons of potassium per half cup. That's nearly half of what a banana has. More importantly, pineapple contains bromelain, an enzyme that helps reduce inflammation and improve digestion. Inflammation in the gastrointestinal tract can indirectly affect kidney health due to the gut-kidney axis, which is now being researched more seriously in the United States. Bromelain has been shown in animal studies to reduce markers of renal inflammation, and there's growing interest in its use among nephrologists. Just be cautious with canned pineapple. It often comes with added sugars and syrups. Fresh or frozen pineapple is always the better option. And since pineapple is naturally sweet, it can be a great substitute for sugary desserts that diabetic CKD patients are usually told to avoid. Cherries are highly anti-inflammatory and extremely effective at reducing uric acid levels, which is a major concern in kidney disease. High uric acid levels can lead to gout, and gout can cause permanent damage to the kidneys if not managed. In many parts of the United States, especially among older men with CKD, gout and hyperuricemia are common. Cherries, particularly tart cherries, help reduce serum uric acid and C-reactive protein, a key marker of inflammation. They're also relatively low in potassium, about 150 milligallons per half cup, making them generally safe if consumed in moderation. Some veterans with CKD in the United States have shared stories about how incorporating cherries helped reduce their need for uric acid-lowering medications. This doesn't replace medical treatment, but it does show that diet can have real, noticeable effects. Frozen cherries are just as effective as fresh ones, but again, avoid added sugars, especially if blood sugar management is a concern. Pears are an underrated fruit for kidney health, especially in stage 3 and stage 4 CKD patients. They are low in potassium, averaging around 120 milligrams per half cup, and extremely high in dietary fiber. The soluble fiber in pears helps control blood glucose, improve lipid profiles, and maintain healthy gut bacteria, all factors that influence kidney function. In renal nutrition plans provided in many U.S. hospitals, pears are used as a safer alternative to high-potassium fruits like bananas or cantaloupe. Pears are also hydrating, contain antioxidants like quercetin, and have anti-inflammatory effects that benefit Cardiovascular health. For patients dealing with proteinuria, controlling inflammation is critical to preserving the kidney's filtering abilities. Soft, ripe pears are easier to digest and are less likely to cause gastric distress, which is important because many people with CKD also suffer from gastrointestinal complications. Watermelon is often controversial in CKD diets because of its water content, but the truth is that when used carefully, it can be beneficial. It's extremely hydrating and contains lycopene, an antioxidant linked to reduced kidney inflammation. But the key is portion control. A small wedge of watermelon, about 1 cup diced, contains roughly 170 milligrams of potassium. That's moderate, not low, but also not dangerously high if you're managing your intake. Some patients in the United States with stage 3 CKD have reported improvements in hydration and urine output when adding watermelon in small amounts, especially during summer months when dehydration is more common. Watermelon is also one of the few fruits that CKD patients find satisfying without needing added sugars or flavorings. But those on fluid restrictions or with advanced stage kidney disease must strictly limit the quantity. Another lesser-known, but extremely beneficial fruit is blackberries. These berries are gaining more attention in the renal diet community because of their exceptional antioxidant profile. Blackberries are loaded with vitamin C, vitamin K, manganese, and polyphenols, like anthocyanins and flavonols, which help protect the kidney tissue from oxidative damage. People with CKD have a higher rate of reactive oxygen species in the body, which accelerates nephron death and fibrosis. Antioxidants from whole foods like blackberries help mitigate that damage. A half cup of blackberries contains only about 117 mg of potassium, making them a safe and powerful choice for CKD patients, especially in stages 2 and 3. They are also low in sodium and phosphorus, which makes them suitable even in more advanced stages. In Australia, dietitians often recommend blackberries as part of renal snack options because they help fight inflammation without spiking glucose or potassium levels. Some patients have shared how switching from processed fruit snacks to blackberries improved their blood pressure and reduced sugar cravings, two critical improvements for kidney health. Raspberries deserve attention for their high fiber and anti-inflammatory properties. With about 186 milligrams of potassium per cup, they're considered moderate, so portion control is essential. But their benefits go far beyond potassium content. Raspberries contain ellagic acid, a powerful compound that has been studied for its ability to reduce kidney scarring in animal models. In CKD, the glomeruli, the filtration units, often become scarred from chronic inflammation and hypertension. Nutrients in raspberries appear to help block the inflammatory pathways that lead to that damage. In the United States, some renal diet protocols include raspberries for patients who are trying to manage both kidney disease and prediabetes or insulin resistance, since the fiber content helps reduce post-meal blood sugar spikes. Many CKD patients experience fatigue, and the B vitamins and antioxidants in raspberries help support energy metabolism. They're also hydrating and can be used to replace high-sodium or sugary snacks that worsen kidney strain. One fruit that often raises questions is mango, and while it's not suitable for everyone, under specific conditions it can be included. Mango is naturally high in natural sugars and moderate in potassium, about 277 mg per cup of diced fruit. This means it's not suitable for patients with uncontrolled potassium levels or advanced stage CKD. However, in early CKD stages or in patients with stable potassium control, mango offers some significant anti-inflammatory compounds like mangiferin, which has been studied for its potential to reduce kidney fibrosis and oxidative injury. In the United States, many patients mistakenly believe they need to avoid all tropical fruits completely, but that's an oversimplification. The key is total daily potassium, phosphorus, and sugar intake. For those under strict medical supervision, a small serving of fresh mango can provide valuable nutrients without overwhelming the kidneys, especially when used to replace processed sweets or desserts that are much more damaging. Another fruit that should be talked about more in CKD communities is the plum. A small plum contains about 104 milligrams of potassium, which is considered low, making it a great choice for kidney patients who crave sweet but safe options. Plums also contain phenolic compounds and vitamin K, which help regulate inflammation and support blood clotting. For patients in the United States who are on blood thinners due to cardiovascular issues related to CKD, vitamin K balance is crucial. Plums can support vascular health without pushing potassium levels too high. They also aid in digestion and help prevent constipation, which is a common issue in patients with kidney disease who take phosphate binders or iron supplements. Some patients report better bowel regularity and reduced bloating after including plums into their diet 2 to 3 times a week. As with all fruits, canned or syruped plums are harmful and should be avoided due to the sugar and preservative content that can worsen kidney inflammation. Peaches are another excellent fruit option for kidney patients, but only when fresh or frozen without added sugars. Peaches contain vitamin C, beta-carotene, and a variety of antioxidants that support kidney tissue repair and reduce inflammation. A medium-sized peach has about 190 milligrams of potassium, putting it in the moderate category. But the benefits outweigh the risks when consumed in proper portions. In Canada, many renal dietitians include peaches in summer renal diets due to their hydration-supportive properties and low phosphorus content. CKD patients often face the problem of fluid retention, so balancing fluid intake with hydrating foods is key. Peaches also help reduce cravings for sugary processed foods, making them a better alternative for people struggling with obesity and diabetes-related kidney damage. Many people have shared personal stories of how switching to peaches instead of ice cream or baked desserts helped improve their A1C and weight control, two huge factors in kidney disease progression. Clementines, part of the citrus family, are another option often misunderstood. While oranges are typically too high in potassium for CKD patients, clementines have a slightly lower potassium load, about 131 mg per fruit. This makes them borderline, safe for some early-stage patients or those with careful potassium monitoring. What makes clementines useful is their high vitamin C content, which supports immune function and helps reduce anemia, a common complication of CKD. Many people with kidney disease also develop chronic fatigue due to poor erythropoietin production and low red blood cell count. Vitamin C enhances iron absorption from food, which supports better hemoglobin levels. In moderation, and only under supervision, clementines can play a small but helpful role in supporting overall kidney health, especially when dietary iron is low. The problem arises when patients in the United States consume multiple citrus fruits in a day without tracking potassium, leading to unexpected spikes. It's essential to talk about papaya, a tropical fruit that contains papain, a digestive enzyme with anti-inflammatory properties. Papaya is moderately high in potassium, about 264 milligrams per cup, so not every CKD patient can tolerate it. But papaya contains vitamin A, folate, and beta-carotene, all of which are essential for immune function and tissue repair. In the United States, papaya is rarely part of renal diets, but it has been used more often in Australia and parts of Canada, especially in populations where plant-based diets are encouraged for kidney protection. Some studies suggest that papain may help reduce markers of uremic toxicity, although this is still an emerging area of research. Papaya also supports digestive health and regular bowel function, which can indirectly help kidneys by reducing systemic inflammation. If your diet allows for moderate potassium intake, papaya could be a strong addition a few times per month, not daily. Another option worth noting is nectarines, which are similar to peaches but slightly higher in potassium, about 285 milligrams per medium fruit. This means nectarines fall into the moderate-high category and should only be consumed by patients with good potassium control. What makes nectarines valuable is their flavonoid content, which can help reduce inflammation, support endothelial function, and potentially slow vascular calcification. a serious issue in CKD. In the United States, especially in hot states like Arizona and Texas, nectarines are often consumed in high quantities in the summer, and that's where the danger lies. 1. Fruit is acceptable under the right conditions, but multiple servings can push potassium too high and stress already burdened kidneys. For patients with hypertension-related kidney damage, the flavonoids in nectarines may offer some vascular protection when used sparingly. It is also critical to track phosphorus, and not just potassium, when including stone fruits like nectarines in a renal diet.